Good afternoon, everyone. My name is Mags Rogers. I'm the Executive Director of the Neurological Alliance of Ireland, and I'd like to welcome you all to this online event calling for a neurologist for Portlaoise Hospital. The Neurological Alliance of Ireland is the national umbrella for over 30 neurological charities. Our event today is part of our 2024 Patients Deserve Better campaign in association with Roche Pharmaceuticals, and we're calling for consultant neurology services in 5 hospitals across Ireland. What we have at the moment is a clear postcode lottery, where some regional hospitals have outpatient neurology services and some, including Portlaoise Hospital, don't, despite the recommendation in the 2016 Model of Care for Neurology Services in Ireland that all Model 3 hospitals should have a dedicated outpatient neurology service. You'll hear this afternoon how people with neurological conditions are travelling to hospitals as far away as Dublin when they could be seen more easily and quickly in Portlaoise Hospital. I'm delighted to welcome our panel of speakers this afternoon. We have Dr. Petya Mihailova, who's consultant neurologist in Tallaght Hospital. We have Martina Sinnott, a local person living with Parkinson's disease from Portlaoise. And we have Tony Flanagan, a local Peace Commissioner and chair of his local MS Ireland branch. All of those people will point out that people are travelling, as I say, to Dublin hospitals when they could be seen more easily and quickly in Portlaoise Hospital. Just a quick housekeeping note, this is a webinar, so people can't join to offer their opinions or to comment, but I do want to thank the elected representatives who's joined this webinar this afternoon. We have representation from Deputy Cathal Berry, Patricia Ryan, Deputy Michael Lowry, and Minister Sean Fleming's office. And also, we just have apologies from Deputy Charles Flanagan, whom I spoke to last week, and he offered his full support for what we are asking for in terms of neurology services for Portlaoise Hospital. So I'm going to introduce my first speaker, Dr. Petya Mihailova from Tallaght Hospital.
Good afternoon. First of all, I would like to thank Ms. Rogers for inviting me today to address the issue of geographical inequity for patients living with neurological conditions in Ireland, and more specifically to highlight the need for a consultant neurologist for Midland Regional Hospital Portlaoise. I'll start just with gently reminding you what a neurologist do. A neurologist is a medical doctor who is an expert in diagnosing, treating, and managing diseases and conditions of the brain and the nervous system, including brain, spinal cord, and nerves. And these conditions include epilepsy, multiple sclerosis, Parkinson's disease, MND, Alzheimer's disease, stroke, headaches, and migraine. And in particular, migraine is the most common neurological condition affecting more than 20% of the population, or over 500,000 people in Ireland. Furthermore, I would like to make you aware of the fact that Ireland has one of the lowest ratios of neurologists to population, approximately 1 neurologist per 114,000 people, versus European median, which is nearly 5 neurologists per 100,000 patients. Furthermore, our experience and the widely available data suggests that neurological disorders account for 1 in 5, or nearly 20% of visits to emergency department, and headache, stroke presentations, and epilepsy are in the top 15 of these presentations. As Max already mentioned, the Model of Care for Neurology from 2016 recommends that all Model 3 hospitals should have a dedicated outpatient neurology service. However, there is currently no neurological service in Portlaoise Hospital. Tallaght Hospital has traditionally provided a super-regional service to Portlaoise Hospital and its catchment based on a gentleman's agreement, but there has never been any formal agreement. However, due to a lack of inpatient bed availability, there is often a significant delay in neurological assessment of acute patients from Portlaoise Hospital. What is the current situation? Any patients requiring neurology input are referred to Tallaght Hospital and are either seen as an outpatient or transferred for inpatient management. This leads to an unacceptable delay in diagnosis and appropriate management, as well as delaying discharge from acute medical beds in Portlaoise Hospital. A consultant neurologist supporting Portlaoise Hospital, mirroring the satellite service provided to Nesa General Hospital, for example, would have a significant and favorable impact on patient care in Portlaoise, enabling more rapid diagnosis and appropriate management of patients with neurological conditions, thereby facilitating more rapid discharge from hospital, improving emergency department waiting times, bed availability, and flow through Portlaoise Hospital. Averaged over 2018 and 2019, Portlaoise Hospital admitted 64 patients with a stroke per annum, and 225 patients with seizures or epilepsy, and 231 patients with headache. This equates to over 11 such common neurological presentations per week, none of whom have access to a timely specialist opinion, and the numbers have since increased. Furthermore, ready access to an on-site rapid access neurology outpatient clinic for patients referred from the physicians within the hospital would facilitate earlier discharge for low complexity presentations such as migraine or other headache presentations and seizures, etc. And the latter patient group currently have an average striking length of stay of almost 3 days, which could be reduced with the introduction of integrated seizure pathway. A provision of neurology outpatient clinic in Portlaoise would have the dual advantage, first of providing a necessary timely service locally to facilitate patients and local physicians who are currently trying to manage neurological cases, and thus offer support to other specialties within the hospital. And secondly, it will have an impact on reducing referrals to neurology outpatient clinics in Tallaght. In 2014, Tallaght Hospital received 7% of the referrals from Portlaoise Hospital, and referrals have doubled since then. An audit in October 2018 identified that 11% of patients attending Tallaght neurology outpatient were from Portlaoise immediate catchment area. And a long outpatient waiting list means some patients have to wait well over 2 years for an urgent appointment. Currently, there are 543 patients on Tallaght neurology outpatient waiting list with address within the Portlaoise immediate catchment area, and 356 of these patients have been referred since January 2023, meaning in the past 16 months. This absolute number would justify the presence of a neurologist there. In January 2019, it was agreed at a meeting of all Dublin Midland Hospitals Group neurologists with the Dublin Midland Hospitals Group Executive Clinical Director that access to on-site specialist neurology at both Midland Regional Hospitals Tullamore and Portlaoise was a priority for the group. A working agreement was secured that St. James's Hospital will develop and provide the service to Tullamore Hospital, and this has been in place since 2022. And that Tallaght Hospital would do similarly to Portlaoise Hospital. A business plan was discussed with our medical colleagues in Portlaoise Hospital, and subsequently the case was submitted in 2020, but unfortunately it did not progress any further. And the lack of such a service, as already highlighted, was identified as a serious gap in the 2016 National Clinical Program for Neurology Model of Care that all Model 3 hospitals should have a dedicated neurology service. Neurological conditions are very often chronic. Patients attend the service for many years, sometimes for decades, for neurological appointments and specialist care. But a lot of these people will have a confirmed neurological diagnosis, and there is no reason why they could not be seen in the outreach regional hospital. Furthermore, a local access to consultant-led neurology outpatient clinic in Portlaoise would allow for urgent assessment, investigation, and treatment of patients with low complexity neurological presentations in a timely manner, which would lead to avoided hospital admissions for such patients attending ED, would reduce the need for unnecessary ED attendances and unnecessary investigations, with a focus on patients' well-being and quality of life. Such a service is critically needed as the lack of local access to neurological service is associated with unacceptable journeys for patients who live far away from the hospital, increasing the burden not only on patients but also on their families. There are a number of challenges associated with travel for medical appointments, including disability. Patients often and their relatives have to take time from work, get childcare, not to underestimate the cost of travel, stress of journeys, etc. As outlined in the Sláinte care strategy, patients should have access to the right care in the right place at the right time, which means getting appropriate medical expertise in a timely manner locally. To address the geographical inequity, we are advocating for a dedicated consultant neurologist in Portlaoise Hospital who will facilitate enhanced access to timely consultant-provided and consultant-led care to patients requiring neurological assessment and management. Additional consultant staffing is urgently required for the growing population of the region, with the attendant demand and waiting time for specialist assessment, both on an inpatient and outpatient basis. This has been agreed among all Dublin Midlands Hospital Group neurologists and would be strongly supported by the physicians in Portlaoise, who we have been advised and assured are crying out for help. Thank you very much.
Thank you so much, Dr. Mihailova. And just to summarize what you've been saying, there is a plan in place. There has been a business case on the table since 2020. And part of the solution has been implemented in other hospitals. Part of the solution that was agreed for the Dublin Midlands Hospital Group has been implemented in other hospitals, including Naas, including Tullamore, but not in Portlaoise. And you're just to stress that the proposal has the support of the neurology service in Tala Hospital and the services throughout Portlaoise Hospital, that there would be a dedicated neurology service in Portlaoise Hospital. Thank you so much. Thank you for chatting me. Can I move on now to Tony Flanagan? Tony is a local peace commissioner, well-known man throughout Portlaoise. He's also the chair of his local MS Ireland branch, and he's just going to speak about his experience of travelling for a number of years now to see his neurologist in Dublin. If you want to join us, Tony. Is Tony's on mute there? That takes just getting.
I have it done now, have I?
Yes, you're fine now. I can hear you if you want to go ahead.
Thank you so much. Doctor, thank you for your lovely talk of what you say is going to happen. I'm getting woven here. 2020 is now 2024. I was diagnosed with MS 44 years ago in 1980. And as you know, doctor, at that time, they didn't know a lot about MS. I'm very, very lucky to be going to St. Vincent's Hospital for all that time. But the stress and strain, since I was in the army, and I hope Cathal Barra has listened to me there now, because he would know me. Cathal would know me very, very well, because Cathal was a member of our post 27, before he got elected. It's very, very important that we do have this service in Portlaoise, doctor. And I only hope and pray that this comes true, because I know the lady Martina Sinnott, she probably doesn't know me now, but I know her well. It's the travel. Just like last Monday, I had an appointment with Dr. Tuberty, Professor Tuberty, up in Vincent's Hospital, a part of his team. But for me to go there, I had to get a taxi from my house up to the station. I had free travel. I was going on the free travel up to Houston Station, but then I had to get a taxi across to Ellen Park, a taxi back, because I was caught with specific times to catch a train. Now, last Monday I missed the first train due to nobody's fault, when there's so much traffic coming back with the taxi, and I was late. But the stress and the strain of that on me, I got into bed when I went home, just to lay down, just to relax. And as you said, the stress and strain of my wife, who's now passed away 2 years ago, for her was unbelievable, because she was like, did I get up there? Am I getting back? Am I safe going up and down? It's, as you know, stress is no good for MS, for any other neurological disease. It's the stress that kills us. And I'm only hoping that Sean Fleming is listening there now today, and Cathal Berry, they both know me personally, that it's now election time. I was on Radio 3 this morning and spoke quite clearly about the MS and the disadvantages if you have no transport, if nobody to look after you. I have people to look after me, but there are people who have MS, who have Parkinson's and all the other neurological conditions, and nobody to mind them. It's great that we'll be able to go to Portlaoise. I only hope and pray that this does come true, because we have a lot of people here. I'm lucky enough, there's a lady here that drove me up here today, and she's right to the right-hand side of me here, and I think you all know her. She's thanking me. Doctor, I only hope and pray that I can see you someday in Portlaoise. The only thing I have a big question, after being in the army, would my files be able to be seen from Portlaoise? I'm just wondering that now, because everybody have their own. I have a file that's that size. There's 44 years of stuff in it. I couldn't knock the service up in Dublin, but it's just getting there, doctor. The stress of getting there, the expense of getting there, and it's horrific on a person, and especially, as you said, young ladies to have little kids, and they're trying to get the kids to school, to get somebody to mind the kids. Will there be somebody there when if I'm there to bring the kids home from school? I only pray and hope that we shall be successful in getting this. Thank you to each and every one of you. And the only thing I wish to for thee is good health. Thank you.
Thank you so much, Tony. I think you've given a very powerful testimony there of, as I said, the impact on you, and just that practical example, as you said, of if you can't get the train on time, you know, and people wait for these appointments, as the doctor said, sometimes they wait months, sometimes they wait years for this appointment. And then if you're depending on trains to get there, if you're depending on a family member to drive you, when there's no reason why people, as we've heard this morning, people couldn't be seen more easily and quickly in Portlaoise Hospital. So thank you so much, Tony. And we just heard there in the chat from Deputy Colberry, he hears you loud and clear.
That's okay. I'm glad he got his hearing fixed, tell him.
Thank you.
He'll understand the joke.
Perfect. And we'll bring in our final speaker this morning, Martina Sinnott. Martina lives locally with Parkinson's disease. So if you just want to tell us about your diagnosis and your experiences, Martina.
No problem. Good afternoon, everybody. As Meg said, my name is Martina Sinnott. I'm 59 years old. I was married to John, and I have 4 grown-up children. I was diagnosed with Parkinson's disease in 2003 at the age of 38. I attended a neurologist in St. James's Clinic for 13 years following my diagnosis. At that stage, my condition was deteriorating, so I transferred to a neurologist in Tala. And from there, I started a journey towards deep brain stimulation. It's a surgery to put electrodes into your brain. I'm sure everybody probably knows what that is. Having completed assessments in both Tala and London, I was accepted as a suitable candidate for DBS. I had my surgery in London in March of 2018, which was a great success. And I now attend a neurologist in Tala, the same neurologist, but in Eccles Street, because it's a dedicated DBS thing. On the day of my appointment, my husband has to take a day off work, which results in either a loss of earnings or a day's holidays gone. Whereas if a neurologist was available in Portlaoise, he wouldn't have to do that because I could drive myself in. I only live about 15 minutes from the hospital, and I'm very familiar with the area, whereas it takes an hour and a half to get to Dublin, and that's if there's no delays in traffic. This caused a lot of anxiety and stress, which we all know is not good for someone suffering from Parkinson's disease or any other neurological disease. It just drives the symptoms wild. First of all, I get anxious about leaving on time to avoid any delays along the way. And the next obstacle when you get to Dublin is finding a parking space. Even though I am a holder of a blue card, blue badge, there's seldom a disabled space available. near the hospital door. So due to the fact that I've reduced mobility and can't walk very far, again, this causes stress and anxiety. And often John has to drop me at the entrance to the hospital and go off and find some place to park. By the time I get to see the neurologist, I'm totally stressed out. So it's very hard to think or to explain how I've been since my last appointment. And that's, of course, very important. Then there's the issue of meds on time. As anyone knows, a person with Parkinson's disease is vital that they get their medication at a dedicated time. And your meals, you usually have your meals and your meds planned around at the same. You know, you have your plan for the day, you can't take your meds with your food and all the rest of it. And your whole day is gone traveling up and down to Dublin, and your routine goes out the window, and it can sometimes take days or even a couple of weeks to get back on track once you miss a dose of medication on time. If there was a neurologist in Portlaoise, it would make a huge difference to me, as I would reduce stress levels and wouldn't have to worry about traffic or parking and disruption to meals and medication. It would be like a dream come true to people from the Midlands area to have a neurologist in Portlaoise Hospital instead of having to travel to Dublin. That's my story. Thank you very much.
Yep.
Martinez, thank you so much. I think, again, you've given a very powerful testimony there of all of the different impacts for you and for your family of making these regular journeys from Portlaoise to Dublin to see your neurologist. And as I say, how it would make so much difference to both of your lives.
Absolutely.
And to so many people throughout the Midlands if there was a neurology service in Portlaoise Hospital. I want to thank all of our speakers this afternoon, but I just want to recap just on a few points that have been made. So Dr. Mihailova joined us from the neurology service in Tallaght Hospital to outline that this plan has been in place. This plan has the support of the neurology service in Tallaght Hospital. It has the support of the staff throughout Portlaoise Hospital who are crying out for a neurology service. And you've heard that it has the strong support of patients and their families throughout Laois and surrounding counties. This plan has been promised as far back as 2020 that there would be a dedicated neurology service in Portlaoise Hospital, and we're calling on this plan to now be delivered for patients and families throughout these counties. I'd like to thank all my speakers this afternoon for their research, for their testimony, for giving such an insight into the need for and the value of a dedicated neurology service in Portlaoise Hospital. We in the Neurological Alliance of Ireland will be driving this campaign right up to the budget this year. We're looking for a dedicated neurology service across 5 regional hospitals, including Portlaoise Hospital. We are only looking for what has been promised. These plans are on the table for each of the hospitals that we're looking at in Letterkenny, Wexford, Mayo and Portlaoise and Wexford hospitals, Bantry Hospital. As I say, plans have been in place to deliver neurology services in all these hospitals. I'd like to thank everyone for the support and also to find out more about this campaign by visiting www.patientsdeservebetter.ie. Thank you for your support.